Chantal Snyder, 341 video recording. Hi, Mrs. Z, this is Chantal. I'm going to be your nursing student or your nurse today. I know it's hard for you to talk with your trach in, so I just want you to give me a thumbs up just to verify everything is correct. So I'm just going to verify your name and date of birth here. So I have Jane Z, date of birth May 6th, XXXX. So thumbs up, that's great, thank you. What we're going to do is I'm just going to oxygenate you. I'm going to hyperoxygenate you. I see that you're at 35% now, so I'm just going to oxygenate you to 100%. This way, we can give you what you need. And I'm going to go ahead and take a listen to your lungs. Okay, and I do hear some bronchi, so we're going to go ahead and do some suctioning for you. Also, the doctor has ordered a few other things for you to be done, and I'm going to go ahead and walk you through that as well. So, let's go ahead and get started. So first we'll start with the suctioning. Okay, so this is a brand new bottle of saline. We're going to date it and mark it with my initials. this is my dirty hand, my left hand. I'm going to just double check and make sure the suction is working. Okay, so what I'm going to do is I'm going to insert the suction. You're going to feel some popping, and then we're going to go ahead and suction it, okay? And suctioning down. Alright, I'm going to wait a minute. Clean the suction. I'm going to do this again. Resistance. Wait another minute. Clean the suction. And one last time, this is the resistance. Okay, nice job. I promise we won't do that again. Okay. All right. Clean it up. Out of the way. Next, we're going to go ahead and clean your trach area. Let me go grab another set of gloves. Shiny side down. Okay. Clean hand, dirty hand. Sterile saline. Okay, so Mrs. Z, I'm just going to take your trach out. No, I'm making a mess. I'm so sorry. Okay. Cleaning the top. Cleaning the bottom. Now we're drying the top. drying the bottom. And we're going to clean the trace. And put it in the rinse container. And now we're drying the tray. There we go. I'm going to put new. That. And we're going to put a new tray collar on just to review that because it looks like the other one is a little messy. Normally there would be 2 nurses doing this, but today it's just me, so I'm going to be doing this. Bring it in place. How you feeling, Mrs. Z? I got a thumbs up. We're good. New tray collar in place. Okay. That on. All right. Hygiene. Okay, now we're going to check your chest tube and see how that's doing. Okay, so before we do that, let's put some new gloves on. This is not a sterile procedure, so we can just use regular gloves. Okay, so let's just take a look at your incision here. Okay, so the incision itself is clean, dry, and intact. No subcutaneous emphysema, so everything looks good there. No pain, everything's good. All right. So what we're going to do is I'm going to just lift it up here. Let's get your new chest tube ready to go. I'm going to fill the chest tube with 20 milliliters of sterile saline. New sterile saline, filling to 20 milliliters. Open them back. All right, and then I'm going to fill a funnel full of sterile saline. you. So this would normally have a cap on the bottom here, so we're going to set this on the ground. Okay, now we're going to clamp off your chest tube. That is set. All right. The call bell is right next to you here if you need it, and I will just be right outside if you need anything. Thank you, Mrs. D. Let me just take care of one last thing. I'm going to turn down your oxygen to your 35% where you had it. Let's take a listen to your heart, your lungs. No more bronchi. No more bronchi bilaterally. Looks like we took care of those secretions for you. All right, Mrs. Z, it was nice taking care of you, my friend. If you need anything, you just hit that call bell, okay?